Hi, my name's McFarland and I'm a clinical psychologist and head of psychological professions in Sheffield Health and Social Care.
And my name's Dorey. I'm a co-production consultant within psychological services at Sheffield Health and Social Care.
Ben and I co-lead the trauma-informed workstream, which is part of our clinical and social care strategy. So what do we mean by trauma-informed care? Well, trauma-informed care is based upon an understanding of the widespread prevalence and impacts of trauma upon society. What this means is that we move away from, historical models of mental health care, which focus predominantly on what might be perceived as being wrong with a person, to try and understand the impact of that person's experiences, how that's impacted upon their sense of who they are and how they relate to others. In turn, this allows us to better understand and provide personalised care to people, and also design and develop services they prevent or work towards reducing the potential of re-traumatisation for people accessing services, as well as the staff working within them.
We know from working with service users and survivors of trauma that traditional service models have not often recognised the impact of trauma, sometimes focusing on doing to people rather than working with them. Many people's experiences of trauma involve a loss of power or control. If people's experience of services feels similar to this, it can re-traumatise a person. This can make services harder for a person to access. The same can be said for staff working in services who have often had experience of trauma, whether at work or in their personal lives. As an organisation, we are wanting to reduce the potential for re-traumatisation, to create a compassionate culture and safe working environments for staff and the people accessing our service, where each individual is treated compassionately and in line with the story they bring.
Becoming a trauma-informed organisation is not simply a branding exercise or about developing a set of guidelines or rules that services should follow. Becoming a trauma-informed organisation is a quite significant organisational and cultural change process. In order to work towards this, we've developed a range of trainings that are co-led by people who have experience of trauma, either within or outside healthcare settings. Alongside this, we're currently rolling out and going around our different services, supporting them to reflect upon how trauma-informed they are as a service, whilst also co-embedding co-production.
We're just at the beginning of our journey as a trust. If you're interested in finding out more about trauma-informed care, please get in touch with us at the email below or have a look at our Jarvis page.